Dear listeners, it is a pleasure to present to you our study called Robotic Process Automation to identify patients at high risk for perioperative myocardial infarction or injury, PMI. There are 300 million surgeries performed every year, and postoperative death is the third highest contributor to death worldwide. PMI is highly prevalent and highly associated with death after surgery, and the dangerous part about PMI is that most patients are asymptomatic, and that's why it's highly important to measure cardiac troponin before and after surgery to not miss these cases, and this is a Class 1 recommendation in current guidelines. However, this includes daily screening of all patients on the surgery schedule every day to identify these high-risk patients, and you can imagine this comes along with high resources and high workload, and it is one of the main reasons why it's not implemented in most hospitals around the world. We developed a new intervention called Robotic Process Automation, RPA, which are virtual bots who can replicate human tasks within digital systems, and conducted a prospective, blinded, paired reader controlled single-center study. Daily screening for patients at high risk from the surgery schedule was conducted according to predefined criteria. Manual screening by clinical staff and RPA screening were conducted simultaneously and blinded to each other. All discrepant cases were reviewed by an independent clinician who was also blinded to the origin of the result, and this created a reference standard of high-risk patients. More than 600 patients were included. The median age was 60 years and half of the patients were women. 77 patients were at high risk according to the reference standard. RPA screening was able to identify 75 patients and manual screening was able to identify 63 patients, and this resulted in a sensitivity of 97% for RPA screening and 82% for manual screening, a relative true positive fraction of approximately 1.2, and a number needed to screen of only 6. We conclude RPA screening has excellent diagnostic accuracy to identify patients at high risk for PMI, and this study provided necessary evidence for an implementation study. Thank you for listening.